Good morning, everybody. It's Dr. Pearlman. I want to make a video. It's been a little while, especially for something like this, and I'm just going to come out right and say this might sound controversial. It's not. This might sound like it's coming from a place of anger or frustration. It's not at all. I am making this video to make something that's very clear to people that both consume chiropractic, want to consume chiropractic, and for people that practice chiropractic or that are in the realm of chiropractic. And that's why when I say it's controversial is you'll kind of see where it's going, and I'll try to keep it short. So here we go. You know, when you are going to a chiropractor, unless you as the patient, and don't look at it as like you, the patient that's paying, will dictate what they want or anything like that, because there are services like that, right? If you go to massage and you say, massage therapist, I want you to work on my traps for 30 minutes. That left trap is really, bothering me, and I've got these knots that nobody can seem to get, and they have to go really hard. That is very understandable, and then the therapist may accommodate. But in the realm of chiropractic, at least the way that I practice, and my hopes is that everyone else practices, it's that you as the doctor are the person that is setting the guidelines and the expectations for the care that somebody needs. Now watch this now. Based on the premise that we understand that all of our patients out there, and you as the patients out there, are educated on what chiropractic's job is. What is a chiropractor's job with you? And this I'm going to just kind of reduce to something that should be really simple. And I'm not talking about what modalities you do in your office. Everything you do to get the end result of what I'm about to say, I don't care, it's up to you. But inevitably, we all kind of as chiropractors have to understand that our job is to reduce what we call subluxation. We are there to, or our patients come to us, at least 99% of what I see in practice, and I believe is still to be true, is that people seek us out to adjust their spines. And by us adjusting or manipulating their spines, call it what you want, we are reducing the subluxation or the interference to the nervous system, or the thing that is a dysfunctional joint that is causing, proprioception misfiring, neuronal pattern misfiring, inappropriate pain and dysfunction at a joint. And if we remove that interference, or we correct that joint on some level, whether it takes 1 visit, 10 visits, whatever, 2, 3, who cares? Who knows? The patient, though, has to understand that our job is to adjust and reduce the subluxation. So my message is, as again, you, the consumer, us as the doctor, don't please, as a patient, expect me to adjust your left C6, your right C5, your right L5, your left PI ilium, your middle thoracic, and then finish with a ring dinger or a Y strap on the same day, because that's not chiropractic. You see what I'm saying? I don't, and again, here I am saying it's not chiropractic, and again, I'm not judging that doing a full spine adjustment isn't chiropractic. What I'm saying is the expectation has to be that when you come to the doctor's office, because we are doctors of chiropractic, and we are specifically trained in, locating joint dysfunction that's leading to physiologic, neurologic dysfunction, and removing that. So if that means we adjust one thing on that day, one side, one adjustment, one segment, C5, and that's the game. And that's the way it is. And if that's what's going to get you the best result. And then you as the patient, or again, us all as consumers, if we go there and we get that one adjustment on C5 and it's not delivering some kind of a desirable positive outcome, even in a short window, I understand that might be frustrating, and then maybe you should go seek someone else. Maybe you should come back and try it again. Who knows? That is the sort of the world we live in. It's the choices that we make, and it has to do a lot of time with the trial of care. But again, I just wanted to put this out there, and in summary, the chiropractor's job is to remove, interference, however you want to define it, from that joint, make the specific good correction. If it's one adjustment that day, it's one adjustment. If it's 3 adjustments that day, it's 3 adjustments. If it's 5, it's 5, whatever. But you can't expect as a consumer, hey, they didn't do enough. Because, a lot of the times, I try to educate my patients the best I can. I'm going to leave it at this, is there's the wellness aspect of chiropractic, and wellness is great because a lot of times wellness does sort of include a little bit more adjustments that are a little bit less forceful. I hate even using that word, but my patients know what I mean. They're a little bit more gentle adjustments, a little bit more just overpressure, specific to certain areas. Wellness, kind of keep things going in the right direction. We don't want to like trigger this massive kind of immune, neurologic, physiologic response unless we're trying to change something that is dysfunctional. And that's more of like an acute, oh my God, subluxation based, we've got to correct this now. I don't know, you want to call it emergent chiropractic? I hope that all makes sense. That's where I'm coming from. I'm going to leave it at that this morning. I really wanted to make this video. I know it's been a while since maybe you guys even have seen me in this light. It's been ridiculously busy on top of the fact that I've been going through some personal things. I'll tell you, man, 3 weeks now of just the worst sinus infection ever. That was gone in about 3-4 days. But actually, I can feel this underlining, short, kind of dry cough that's kind of lingering up here in the upper cavity. It's not been fun. But guys, if you have any questions, feel free to reach out. Thank you for tuning in again, and it is Dr. Pearlman.